There are natural changes that seniors experience as part of the normal aging process, such as slowing down physically and cognitively. However, if the behavior of your loved one begins to become uncharacteristic or outside of the normal progression of aging, it may be time to examine the situation. So, what are considered normal behaviors of aging? Examples include instances like being slower to think or act, hesitating or thinking before making decisions, trouble word finding or mixing up names, but always remembering the person. Meanwhile, some of the warning signs that someone may be experiencing dementia include examples like being unable to think the same or do as they once did, being unable to begin tasks or think through things, being unable to recall a person's identity, confusion about past and future events, or getting stuck in a moment in time, word recall not coming despite visual, verbal, or touch clues, and reacting abruptly to situations or losing interest in previously enjoyed activities. If you are caregiving for a loved one living with dementia, one of the most important things to remember to support their dignity is to see your loved one for who they are and not allow them to be defined by their disease. For example, people living with dementia are often labeled by negative behaviors: lonely, angry, confused, hoarder, violent, wanderer, or depressed. By labeling a person living with dementia, we are seeing only the disease and limiting or ignoring our curiosity about them as a person. This is what is known as the social impacts of the disease. It's when we know someone has the disease and our negative assumptions about the disease guide the way we interact with them. So how do we as caregivers overcome our habit of accepting what is on the surface rather than engaging meaningfully with our loved one? First, we need to see their behaviors are a form of communication. Remember your loved one's habits, preferences, thoughts, likes, dislikes, fears, and history. This is the context you will need to communicate and interact better with them. Ask questions, listen for clues that can give you context as to how they are feeling, and try to distract them from unpleasant feelings or address what they need to feel better. For more information about dementia, as well as Chartwell's memory care and memory living services, visit chartwell.com.